Hello everyone, I am Sonali. Welcome to Socialpost. Today we have Dr. Chava Anjaneyulu, founder of Asian ENT Care Center. So let's have a podcast with him. Hello doctor, how are you?
Fine, ma'am.
So also many people they think that there is something stuck in their throat even though the tests are very clear. So what can be the ENT reasons behind that?
Nowadays, this foreign body sensation in the throat, that
Hmm.
means stucking in the throat,
Throat.
the problem is increasing day by day.
Hmm.
And many patients out on this, they're thinking that maybe cancer and they're suffering with the cancerophobia.
They're very scared of
Cancerophobia is you don't have cancer, but
but
you are
think you have
thinking
cancer.
about that.
Yes.
Cancerophobia. But those who are having cancerophobia
Hmm.
also, it is better to get checkup.
Okay.
So we can rule out the local problem, anything.
Hmm.
So most of the times this foreign body sensation in the throat
Hmm.
is mainly due to not taking water frequently.
Okay.
If throat dries, you feel the foreign body sensation in the throat or some sticky sensation.
Hmm.
You want to repeatedly
Yes.
you say, then again after 2 minutes you will be there.
Without
Again you do like that.
without any
Because
reason.
this is basically due to dryness in the throat.
Okay.
Because of you are not taking water properly or you are not keeping throat wet otherwise.
It's
This
dry.
is more common is in stress people, those who think too much.
Okay. Overthinker people.
Either mental stress most of the times, those who think
Yeah.
too much because of the hormonal or neuronal changes, their throat becomes dry.
Okay.
These people mostly will have this throat foreign body sensation.
Hmm.
So you see with endoscopy everything is normal, but
Yes.
patient is feeling problem.
Yeah.
So this is the commonest problem. Second commonest problem is the nowadays gastroesophageal reflux disease.
Okay.
You see throat it is normal. Patients say occasionally I am having stomach pain or some discomfort here. This gastroesophageal reflux is the another common reason that acid will come into the throat. It causes foreign body sensation or burning sensation. Rarely throat pain.
Okay.
But most of the times foreign body sensation.
Okay.
So if throat examination is normal, including laryngoscopic evaluation, if you follow the simple trick, take water every 5 to 10 minutes, sip of water, not like that. You take whatever the regular quantity you are taking, take that water.
Okay.
But every 5 minutes, you sip of water. Try to avoid doing like that. Whenever you feel that, you take sip of water. Over a period of 1, 2, 3 months, that sensation will come down and your habit of doing also come down.
Come down. Yeah.
If these two things if you follow, most of the times the throat foreign body sensation and sticky sensation will go.
Okay.
Along with that, you reduce the intake of spicy food and oily food, coffee and tea. Especially coffee and tea, more times if you take it will keep the throat dry.
Dry. Yeah.
So you take little bit once or twice a day, but reduce that coffee,
Amount of-
tea intake and spicy food and oily food.
Okay.
And avoid stress as much as possible because stress also causes the vague pains in the head and neck region.
Yeah.
Because the ear pain, ear pain, ear pain,
All
ear
are
pain
connected.
everywhere they will say throat is drying. All these non-specific symptoms we call it as. Reduce the stress as much as possible. Most of the times this will go.
So basically, try to keep the throat wet.
Yeah, that is the
Okay.
by taking a simple sip of water every 5 to 10 minutes.
Okay. And whenever people feel that their nose is blocked, they'll take nasal sprays for months. So will our nose get dependent on the nasal spray?
Definitely, and they are dependent on the nasal spray and they will not get relief with the nasal sprays also over a period of time. Yeah, many people now the incidence is came down because people know whenever they have the nose block they have to go doctor. Olden days maybe doctors are not available nearby places and once in a while they go to doctor, they will give some nasal drop and that they will start and continuing.
Even though if they don't go to doctor, they'll just go to hospital like clinic, take a spray, and they'll get dependent on that.
On that they use whenever block over a period of time Initially they use 2 times, after that 3 times, after that 4 times
Four
a day,
times.
after that continuously they are using.
Yes.
Yeah, the people are coming with that issue because it is dependent in the sense you can say they are having problem. That's why they are depending. It is not
Yes.
the thing. Because due to long term use of nasal drops or nasal spray, usually that mucosa congestion increase and rebound congestion will say. When you put the drops, it will reduce. Immediately
Yes.
after 5 minutes, it will increase.
Occur. Yeah.
This is, we call it as rebound congestion or rhinitis medicamentosa.
Okay.
Yeah, long term use of nasal drops is always harmful. Once this condition happens, rhinitis medicament, very difficult to treat. Even we do surgery also. Some patients may feel that nasal block, even their nose is patent by different tests, nasorhinomanometry or tongue spatula test, different tests are there. Basically, for this, as much as possible, don't dependent on drops and don't use drops too much. If anything you need to, or your requirement increase more than 2 to 3 days, show always to the doctor. It is very simple nowadays to treat. Most of the times this happens due to deviated nasal septum or inferior turbinate hypertrophy.
Okay.
These two things we can easily correct. Very simple surgery, it is easily correctable. With that, your nose will get normal and you breathe very normally. If nose deviation is not there, deviated nasal septum, only turbinate, it is very simple. Nowadays lasers, coagulators are there. With that we reduce the turbinate, we desensitize little bit, and our breathing problem will subside. So don't use that nasal drops for long time. Contact the doctor, get the treatment. Is very simple, easy treatment, and you can get a lifelong
Yeah.
breathe free or nasal blockage
Yes.
free.
Because it is temporary that we are getting from a nasal drop for
Nasal
some
drop.
time.
The second thing with the long term use of nasal drop, that rebound that is very very difficult to treat, and the patient maybe psychologically also will get disturbed.
Yeah. True. So, the bad breath which comes out, is it because of the ENT problem? Like people don't understand what is happening basically. So, what is the real cause of having bad breath? Is it connected with ENT?
Most of the times bad breath is due to the throat issue. Mostly in that case also tonsillar issue, because some uh, people they will have deep tonsil crypts. In the deep tonsil crypts, if we eat the food or anything, if it deposits there over a period of time, that will become infected, or it will, like if you have food somewhere you put, after 2 3 days you got bad smell, like that, that smell sensation will come. That is the commonest one which comes because of the deep tonsillar crypts or enlarged tonsils with the deep crypts, that we call it as a tonsilloliths or a tonsillar debris. This is the commonest reason. Second one is, if you don't take water also, your throat is not good, your oral hygiene is not good. That is another reason. Third one is, when you sleep and wake up immediately also, that's why once after night we'll do brushing and cleaning, because some debris or some mucus will accumulate and it causes the bad breath.
Yeah.
Especially some stressed people or stress mind people, once they feel that bad breath, they repeatedly feel psychological and they'll say, I'm having bad breath, I am having bad breath.
Their mind has become like that.
Mind has become like that. These are the commonest things we see.
Okay.
Those who don't have problem, we try to counsel as much as possible. We'll ask the family members to counsel. You see in his mouth, did you feel
Yes.
any bad breath or not? If not feeling, tell him. Like
Yeah,
that,
we'll
many
ask
times
each other.
we try to counsel them. Really, those who are having tonsilloliths and tonsillar debris with bad breath, it is very easy to correct. Just simply you remove the tonsil. It is very simple and simple
Common.
procedure and uncomplicated procedure most of the times.
Okay.
And that is a permanent relief, because the deep crypts we have to remove, otherwise it will accumulate every time. And those whose throat is dry, we say more frequently you wash your mouth with normal tap water. So oral hygiene you can maintain and your breath will
Yes.
good. Bad breath, but especially those who take more carbohydrate sweets, and if they don't clean, they will get gum infections, all those things. Always, if you, especially if you take food or anything, especially chocolate, some sticky substance,
Okay.
better to clean the mouth after
It
that.
will get stuck in the mouth, basically. Okay. And many people, they hear their heartbeats and whoozing sound in the ear, even though when they are not struggling from ear pain or ear infection, something. So why does this happen?
This we call it as a tinnitus.
Okay.
That is abnormal sensation of the sound in the ear in absence of external sound.
Yes.
But outside there is no sound, but he is feeling.
Yeah.
These two things. One is vascular tinnitus. If you feel heartbeat, pulsatile tinnitus. Sometimes you may have abnormal vessels in the ear that may cause this pulsatile tinnitus.
Okay.
That abnormal vessels may be diseased vessels, may not be diseased vessels. Sometimes this normal vessel may be bigger in size and you may feel it.
True.
That is vascular tinnitus. The other one is non-vascular tinnitus. In non-vascular tinnitus, mainly due to inner hair cells damage.
Okay.
It most of the times now, due to more phone use, more loud noise exposure, more
Earphones.
cold weather exposure, more viral infections. Due to this, it is happening.
Okay.
If it is vascular tinnitus, usually we do CT scan all tinnitus patients. The vessel which is giving trouble, if you ligate or you block, most of the times it will subside. That is the only treatment. Second one, this peripheral hair cells damage. We see if patient is having hearing loss with the tinnitus,
Okay.
it is easy. You correct the hearing loss with the hearing aid. Most of the times, the hearing will improve and the tinnitus will also subside. The thing more problem comes if hearing is normal, patient is having tinnitus.
Okay. He's suffering.
That is difficult. Most of these patients will have anxiety issues,
Anxieties.
anxiety, stress, more thinking, all those things. Here we have to do psychological counseling.
Okay.
And another one, tinnitus retraining therapy.
It can be both.
Both. So if we do both together, if patient understand the treatment and his problem, most of the times it will subside. But if any patient is having tinnitus, always immediately contact the doctor, because tinnitus which can be cured if we show or we get the treatment early within 5 to 7 days.
So is it serious problem or?
That depends on the CT scan.
Okay.
Any patient who is having tinnitus, we do the CT scan or MRI depending on the need.
Okay.
In CT scan, we know any serious underlying sometimes rarely tumors may be there between brain and ear, sometimes in the ear.
Yes.
Like vascular tinnitus, some blood vessels, jugular tumors, all will be there. But the situation is rare and the conditions also very rare.
Okay.
So always we do the CT scan. If CT scan is normal, no need to worry. Take the treatment. Sometimes it will improve, sometimes it may not improve. But no worry, because some patients they will come due to sound, I am not understanding, I am not doing any work,
Especially
I don't want to live, all these things. These are the anxiety people. Hyper.
Especially aged people, they will do like that.
These patients are very important, as there is no life-threatening problem. We have to understand that. Take the treatment as much as possible. Most of the times, symptoms may come down or may reduce. So no worry at all.
Okay. And also while traveling, while flying, and when people are in the lift or at the hill stations, they'll feel earfulness and some ringing sound in the ear. And this is very common and natural, not natural, but very common, I can say. Many people will struggle. So what are the things to be prevented, or what can be done?
This is mainly due to between nose and ear, there is a eustachian tube. One opening in the ear, one opening in the nose. If there is any weakening or eustachian tube is not as strong, that the supporting muscles are not strong, then this happens.
Okay.
Even diving or flying or going high altitude, ear fullness will happen because of the collapse of that tube.
Okay.
But this is more common and severe with if you have cold. With cold, if you do traveling,
it will become worse.
More, because already edema is there. In edema, it is easy to get blocked.
Triggered.
So patient will have more problems. That's why most of the times I will advise, if any patient is having cold, unless emergency, don't do flight travel.
Okay. Or also when people travel in flight, crew will suggest them to do some Valsalva movements
That
in
is
the
the thing. Next step.
yeah. So
If patient is only having that type of fullness while traveling
mm,
or while flying,
mm,
I will advise them use some bubble gum or anything, give the movements,
chewing.
chewing,
Mm,
so that tube will open and close will,
mm.
so pressure will not build up.
We'll get some
Along with
relief.
that, you can do some balloon exercise also.
Mm, okay.
So fullness, so that also will improve. It will not block your ears. That while going up and while coming down.
Coming down. Yeah. Especially
If
at that.
somebody is having cold and they have to do air travel,
Mm,
better to take antihistaminics and nasal drops half an hour, 1 hour before going to flight,
traveling. Okay.
because that will reduce your edema and inflammation inside. Along with that, you do your chewing and Valsalva maneuver, so problem will be less.
Okay. So it's normal. It can be prevented.
These are the preventive measures. But if you are having more severe problem, contact the doctor. They will see the eustachian tube opening, how it is too much patless. If it is giving you too much trouble, like whenever you swallow, whenever you talk, if you get sounds in the ear, better to narrow that by putting some material around that, like that.
Yeah, true, true. So, is it true like holding your sneeze for a long time or just holding a sneeze can create a eardrum problem or ear?
It is not good at all. If you are sneezing and coughing, better to leave. You put a finger in front of you, because if you are stopping means building pressure inside.
Yes.
When you increase the pressure inside, the
Hmm.
edema, the mucosa will get edematous.
Hmm.
It will block your nose and ear, all those things. So basically, mucosal edema will happen, that will block the nose and ear, and your ear get fullness.
Earphones. Okay.
So these are the natural things. So better to relieve that pressure.
Okay. So, better keep it out. Okay. So, sometimes people feel tiredness in their voice even though they don't have any throat pain. So, what is the reason why it happens?
Because usually, if you are speaking in between, if your voice become weak, after 5-10 minutes gap, if you speak again, it will come. Most of the times, this may be due to the vocal cord pathology. That may be small vocal nodule, or due to sulcus vocalis, we call it as, or elder people due to muscle weakness. Because child, they can run for long, old people they can't. Same way in voice box also. Or sulcus vocalis will be there. If they speak more time, that muscles become little bit weak, and so that gap, phonetic gap will increase, and that cause this weak voice.
Okay.
But whenever weak voice is there, get video laryngoscopic examination. If video laryngoscopy examination is normal, then get one neurological evaluation, because some
Okay.
muscular problems, muscular disorders may cause the weak voice with the voice use.
Okay.
If neurological problem is also not there, if
Hmm.
neurological side is also normal, it is easy to correct with the speech therapy.
Okay.
Speech therapist will give advice how to speak, they will see your muscle tensions, sometimes spasmodic dysphonias. With anxiety, especially if you anxiety you speak, the weakness will happen after 5 minutes at a time, because with the loudness or with muscle tightness.
Okay.
So initially, most of the times with the precautions, it will subside.
Hmm.
Rarely we may intervene, both medical or surgically,
Hmm.
but most of the times, if your endoscopic examination is normal, no worry at all.
Okay. Okay.